Welcome to Significant Talk. Today we're diving into a statistical method that's kind of big deal in health research. It's called survival analysis. And to help us navigate this topic, we have the awesome Dr. Hamdi Alhakimi, an expert in community medicine, epidemiology, and medical statistics.
Thank you for having me. I'm happy to shed some light on this fascinating area.
All right, so I'd like to jump right in. Let's start with the basics. What exactly is survival analysis, and why is it so essential in health research?
Survival analysis, well, at its heart, it's all about understanding the time it takes for a specific event to happen. This event could be anything, really, like the onset of a disease, a patient's recovery, or even death.
So it's not just about survival, like literally.
Exactly. It's about analyzing time to event data. And what's really cool is survival analysis. It gives us these insights that you just can't get from traditional statistical methods, like regression, for example.
Now, our sources mentioned that survival data often throws in these curveballs, like censoring and truncation. Can you explain why these make things tricky for those traditional methods?
You're right. Censoring and truncation, they definitely add layers of complexity. Imagine we're studying a new heart disease medication, and we're following patients for, let's say, 5 years. But some might drop out or live well beyond those 5 years, so we don't have their complete survival time data. This is what we call right censoring.
So the event hasn't happened yet for some participants
Exact.
when the study ends.
Exact.
But what about situations where the event happens before we even start observing a patient and we don't know the exact time?
That's a great point. And it leads us right into left censoring. Let's take a study analyzing cancer survival rates. If a patient was diagnosed with cancer before the study started, but we don't have that precise diagnosis date, that's left censoring.
So both right and left censoring, they deal with incomplete data,
Right.
which makes traditional analysis pretty tricky. But how is truncation different?
Think of truncation like setting boundaries on who's included in our study based on when the event happened. Left truncation excludes individuals who had the event before the study even began.
Like in that cancer survival study our sources mentioned, that started enrolling patients 2 years after treatment. So anyone relapsing or dying within those 2 years wouldn't be included.
Precisely. They're left truncated. Now, on the flip side, right truncation only includes those whose events happened before a certain cutoff point, leaving out the long-term survivors.
Like a study on a new surgical technique. That only looks at patients who didn't make it past a certain point to assess those short-term risks.
Exactly.
So both censoring and truncation. They present unique challenges because we're working with incomplete data.
You got it.
And that's where these specialized methods become essential.
Right. They help us make sense of all the complexities.
So what are some of the go-to methods for tackling these issues in survival analysis? Our sources mentioned Cox regression and Weibull regression.
You're spot on. Those are both powerful tools, each with its strengths and limitations. Deciding which one's the right fit really depends on the specific type of censoring or truncation we're dealing with.
Let's start with right censoring then, the most common scenario you've talked about. How do Cox and Weibull regressions address that?
Cox regression. It's really good for analyzing the influence of different factors. On the risk of the event happening at any given time, it focuses on calculating hazard ratios, which tell us how much specific variables impact that risk.
So in that heart disease medication example, we could use Cox regression to see how things like age, lifestyle, or even genetics influence a patient's risk of having a heart attack.
Absolutely. Now, Weibull regression. It's great at modeling the entire survival curve. It gives us a comprehensive view of those survival probabilities over different periods.
So while Cox regression helps us pinpoint risk factors, Weibull regression gives us a broader picture of those survival patterns.
Precisely. But when we run into left censoring, where the event happened before we started watching, Cox regression kind of falls short.
So for studies where it's hard to pinpoint the exact time of an event, like when a cancer was diagnosed, Weibull regression is the hero.
Exactly. It can handle those situations effectively.
But what about left truncation, where we exclude patients who didn't make it past a certain point, like in that cancer study? That started enrollment 2 years after treatment.
Both Cox and Weibull regressions can handle left truncation. They take into account that delayed entry to adjust for individuals who are already at risk before being included in the study.
That's reassuring. But how do we deal with right truncation then, where we only include patients whose events occurred within a specific time?
Right truncation. That usually requires a more specialized approach. We use something called truncated regression, often building on Weibull regression as a base.
Like in the study about the new surgical technique, where they only included patients who didn't survive past a certain point.
You got it. These methods make sure we analyze the data accurately, even though we only have a partial view of those survival times.
This has been really eye-opening. I'm starting to see how these data issues can really impact our understanding of health research.
Definitely. Recognizing and properly addressing these complexities is absolutely crucial for drawing reliable conclusions from any survival analysis.
I think our listeners would benefit from some real-world examples to really solidify their understanding. What do you say we move on to some questions they've sent in?
Let's do it. I'm always up for a challenge.
All right, Doctor, let's dive into those listener questions. Our first one comes from a listener involved in a study on the long-term effects of a new diabetes drug. They're tracking patients for 10 years, but some are thankfully still doing great after the study period. What kind of data issue are they facing?
That's a classic case of right censoring. We know those patients survived, at least until this study ended, but we don't have their full survival times.
Makes sense. Next up, we have a question from listeners studying survival rates after a specific heart surgery. They're seeing cases where the exact date of a previous heart attack before the surgery is unknown for some patients. What data issue is that?
That sounds like left censoring. The heart attack, which is the event we're interested in, happened before they started observing the patient, and they don't have the exact date.
Interesting. Now, a listener working on a cancer study asks about only including patients who lived at least 6 months after a specific treatment. What data issue is that, and why would they do that?
That's left truncation. They're focusing on a subset of patients to study long-term survival patterns and how well the treatment works in that group.
So narrowing their focus to get a clearer picture of those long-term outcomes.
Right.
Here's another one. A listener researching air pollution's impact on lung disease. They're tracking patients from when symptoms start. But for some diagnosed before the study, they don't know exactly when symptoms began. What data issue is this?
That's another example of left censoring. Even though the study focuses on symptom onset, those missing dates for previously diagnosed patients create a left censoring situation.
This next question is about analyzing data. A listener studying a new therapy for a neurodegenerative disease. They're following patients for 5 years. But to focus on short-term outcomes, they're excluding anyone who lives beyond that. What kind of data issue does that create? And how does it affect their analysis?
By excluding those who survive past 5 years, they're introducing right truncation, meaning their analysis will only look at events within those 5 years. They'd need to use specific methods, like truncated regression, which often uses Weibull regression as a base, to accurately model the data.
So the choices about who to include and how long to follow them really impact the data analysis.
Absolutely.
Now, switching gears a bit, a listener researching long-term survival rates of kidney transplant recipients, but excluding those who had transplants over 10 years ago. What data issue does this cause, and why would they do that?
This creates left truncation. The researcher might be focusing on newer transplant techniques or medications, so they want a more recent group of patients.
That makes sense. Okay, last question in this section. A listener's part of a clinical trial for a new treatment for a rare genetic disorder. They're collecting data on patient survival, but some are still alive and getting treatment when the study ends. What data issue do they need to consider when analyzing results?
That's right, censoring again. They only have partial survival time data for those participants because the event hasn't happened yet.
Doctor, your explanations have been super helpful in clarifying these data issues. I think our listeners are starting to see how crucial it is to recognize them when interpreting survival data.
I agree. These concepts are really the foundation for understanding the strengths and weaknesses of survival analysis.
And before we move on, any extra insights or advice for listeners who might be dealing with censoring or truncation in their research?
When you come across right censoring, it's important to remember we might not know the exact survival time for those individuals, but we do know they lived at least until a certain point. That information is still valuable. And we can use methods like Cox or Weibull regression to include it in the analysis.
Great point. Even incomplete data can be useful if analyzed the right way.
Exactly. Now, with left censoring, traditional regression methods often struggle because they assume we know exactly when the event happened. So we need to use methods designed for incomplete data, like Weibull regression.
Choosing the right tool for the job is essential in survival analysis.
Precisely. And with left truncation, it's important to remember our findings might not apply to everyone, since we excluded people who had the event early on. Our results only show the survival patterns of a specific group.
So thinking carefully about who's included and excluded is really important.
Absolutely. Finally, with right truncation, it's like we're only seeing a small part of the picture. Our conclusions only work for events happening within that time frame, like focusing on one chapter instead of the whole book.
Great analogy. Understanding the data's limits is crucial when interpreting any study's findings, especially with survival analysis.
Exactly. By keeping these things in mind, we can make sure our interpretations are accurate and relevant to the people and time frame we're studying.
Doctor, this has been incredibly insightful. I'm sure our listeners have a much better grasp of survival analysis now, and how crucial it is to address data complexities like censoring and truncation.
It was my pleasure. I hope this helps everyone understand these statistical concepts and empowers them to look at health research with a more critical and informed eye.
Now, I know our listeners want to hear your thoughts on some specific scenarios. Ready for some more questions?
Absolutely. Bring them on.
All right, doctor, let's get back to those questions. A listener who's on a research team studying a new surgical technique for a specific type of cancer wants to know, what data issue could pop up if they focus on patients who didn't survive the first year after surgery?
That would introduce right truncation. They're basically choosing to look at data only from patients who died within a year of the surgery. This could be useful if they want to understand early mortality risks. But they need to remember that their findings wouldn't apply to those who survived longer.
That makes sense. Now, for a question related to clinical trials, a listener's in a trial for a new drug for a chronic inflammatory condition. The trial's set to run for 2 years. But some patients might stop treatment because of side effects or other reasons. What data issue does this bring up, and how should it be handled?
That's a perfect example of right censoring. We know they survived at least until they left the trial. But we don't know what would happen if they'd stayed on the treatment. That's where survival analysis methods like Cox regression or Weibull regression really shine. They help us account for this censored data and still get important insights about how effective the treatment is.
So even with incomplete data,
Right.
we can get meaningful info with the right tools.
Exactly. That's one of the big advantages of survival analysis.
All right, one last question before we wrap things up. A listener's studying the long-term effects of childhood exposure to an environmental toxin and how it affects the development of a certain disease. They're following people from childhood into adulthood, but some might move, lose touch, or decide to stop participating. What data issue comes up here, and how does it impact the study's findings?
This shows the challenge of right censoring again. For those who leave the study, we just don't know if or when they might develop the disease. This highlights how important it is to keep people in the study, like staying in contact and making it easy to participate.
Dr. Alhakimi, this has been so valuable. Our listeners now have a much better understanding of survival analysis and how important it is to address those data complexities.
I'm glad to hear that. I hope our conversation helps people engage with health research with a more critical eye.
So as we wrap up, what key takeaways would you leave our listeners with?
I'd say remember, survival analysis is a powerful tool. It helps us get meaningful insights from complex data. Even when we don't have all the information, it's really important to recognize those nuances of censoring and truncation, because they can really affect how we interpret study results. By understanding these concepts, people can better evaluate how valid and generalizable the research is.
Thank you so much for joining us today, Dr. Hamdi Alhakimi.
It was my pleasure. Thank you for having me.
And to our listeners, thank you for joining us on this exploration of survival analysis. We hope you found it informative.
We encourage you to keep exploring this field. There are tons of resources online and in libraries.
And don't forget to follow Significant Talk by Dr. Hamdi Alhakimi for more deep dives into the world of health research. We'll be back soon with another episode on a brand new topic.
Until then, stay curious and keep asking questions.
Goodbye for now. And we can't wait to have you back on Significant Talk by Dr. Hamdi Alhakimi.